How is everyone doing? This is Dr. Malik Rahim, and I have another guest, and this is one of my former students. This is Mrs. Tonesha Johnson. Um, Tanisha, wow, I give you an opportunity to introduce yourself to everyone and kind of tell everyone what you're doing. I know that you and your husband are business owners.
Yes, so we have a small business where we design T-shirts. I make hats and scarves and blankets. I knit them. Um, but we're trying to expand into T-shirts, with all the little funny slogans on them. Um, yep. So that's our business, Naughty Fox Apparel.
Is there any way they could go to look at some of your work, Instagram or a website or anything like that?
Yeah, so we have a Facebook page, Naughty Fox Apparel. We have an Instagram, Naughty Fox Apparel. And we have a website, naughtyfoxapparel.com.
Oh, okay. Thank you. Um, One of the reasons I asked you to come here is because, like, I've had you as a student before, and we've known each other for quite a while, and we've had conversations about mental health in the black community, and I just kind of want to get someone who's not a therapist or a professional to kind of talk about what their views are about mental health therapy in the black community. And I know you have some ideas.
Yeah. So I believe in therapy. I believe therapy works. As a person that has gone to therapy, I mean, um, as a child, I want to say really as a child, maybe a teenager. Um, Probably was like the first time that I ever like talked to a school counselor or anything like that. And then as an adult, um, I would say mostly after traumatic surgery, um, I decided to go to counseling. And then through that experience, I started to talk about other things that were bothering me. Um, I enjoyed the counseling. I mean, yeah, the therapy experience is the relief that you get, or that I get, going to therapy and being able to talk to someone that really they're invested in your progress, but not invested in you know what decisions that you're going to make. Um, so that's the aspect of therapy that I really enjoy.
I think you described it so beautifully. I think a lot of us in our community see therapy as the boogeyman, and I know it's been like one of the intergenerational traumas is that we don't air our dirty laundry. What happens in the family, we stay in the family. You don't go out telling people stuff like that, or you'll say, "Take it to Jesus," right?
Right.
So, but it's like I always say, well, God created therapists for a reason, for you,
Exactly.
So, but it's like, and then I think a lot of us get so like confused in thinking that you gotta have like a mental illness to go see therapy, and it's some mental health is about life changes and
Right.
how we adjust and go through life changes, and the thing is, a lot of people don't realize is being black is difficult. You know,
It's something else.
right? And I'm speaking as a black man. I'm not speaking as a black woman. You know,
Yeah. I want to say, hmm, as far as therapy goes, I've been told like don't say certain things when you go. Um, you don't want you don't like you don't want them to think that you're crazy, and you can't say certain stuff. And but for me and my experience, I guess like some certain things that you would say. Um, between us, I kind of change, like kind of change it around so that I don't speak in the terms of how our community speaks. I guess that's what I'm trying to say when I go to therapy. And I also try to find a therapist that is Black, because they understand the struggles that we have. I mean, I'm not gonna say that I haven't had any therapists that were not of color that did not do a great job, because that just wouldn't be true.
Mhm.
Um, but finding a therapist that can identify with you more on, more of a visceral level is really important. I didn't have find myself not having to over explain certain things because they just understood, what it's like, especially um, if you're a woman. I mean, one of my best therapists was a Black man.
Mhm.
Um, but finding a Black woman who understands what it's like to be a mom, to be an employee, a business owner, a auntie, a sister, it's just very important to do that, because like I said, you don't have to over explain yourself. And then it's just, I don't know, it's just like that, that understanding that you get, kind of like when you when you see another Black person and you do that nod, like they get it. They really, they just understand on a different level.
It's funny you mentioned that nod. I was telling one of my friends, one of the most disappointing things in the world is seeing that black person. They see you, and you give them the nod, and they just don't do anything. You know, so you kind of wonder how far in the sunken place are they. You know. But yeah, I hear you, and it's like as a black woman, I'm sure it is very important to have someone be able to understand the black woman superwoman syndrome, of being the mom, the employee, the business owner, the wife, the girlfriend, the confidant, all those things all rolled in one. And then not having anybody, feeling like there's no one to look out for you because you always got to be the strong one. And then on top of that, no one understanding the struggles you're going through because you do it so well that they just look at you like you're supposed to do that. You're supposed to cook. You're supposed to clean. You're supposed to go to work. You're supposed to take care of your kids. You're supposed to do this, and then you internalize that, to where it's like if you're not doing one of them well, you almost feel like you're failing.
Right.
And at the same time, you're drowning by trying to do all those so well.
Yeah. I definitely um, experienced that complex, and especially with my son, just trying to make sure that I do everything perfect all the time with him. And I don't know, like it just one day I just was sitting there and I was just like upset, just crying and stuff. And he's just like, "Mom, what's wrong?" And I'm just like, I don't feel like a good mom. And
Mm-hmm.
he was just like looking at me like, "What are you talking about? Like, you're a great mom, but not being able to do certain things, you're used to being able to do everything." Especially now in the last, I want to say 9 months, it's been a very trying time for my family, with all of the, I don't know, am I allowed to say that word?
The C word,
Yeah,
the
with
the 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 forced disease that's been upon us, and we've been navigating through the virus.
yeah. Um, I had the long C word. So just going to, I've been in a survivor group and
Mm-hmm.
just listening to other people talk and actually talking about it. It's very traumatic for all of us, actually. Having that, and then just your life changing. I guess to make a long story short, just your life is not how it used to be, and trying to navigate the changes, and talking to other people in a um, group setting kind of helps that. But it's just like we have to talk about relinquishing so much control and
Hmm.
thinking about the positive things that have happened. You know, everybody is so focused on what they can't do. There's things that we've been able to do that we weren't able to do before. So just focusing on the positive, I think that's um, one of the my main takeaways from therapy is trying to find like at least every day some positive things to write down, because you can make an endless list probably of all the negative things or the things that you're grateful for. Just
Right.
try to write down at least three things that you're grateful for, and try to switch your mindset from, um, I guess from like over
Catastrophizing.
catastrophizing thing. Yeah. So that's definitely something that therapy helps with, because you like, oh, the world is going to be over, and the world is not over. Or this is happening everywhere, but it's not.
Right.
Certain things, it's not really happening everywhere, it's happening to you, so it feels like it's just the end of everything.
Yeah, I think the funny thing about it is our as a community, I think one of the things is that we catastrophize a lot of things, and it's not necessarily big things. It's little things. It's like I've had people do things like, oh, he didn't call me, he's gonna break up with me, right? Or um, you know, she didn't look at me when she walked away. She doesn't love me anymore. And like it's even like the little things. And it's like I think as a therapist, we try to help people recognize those little subtle um, catastrophes that we put into our lives, and we over zealous them, and it creates a mental health to where it's like it just stresses us out.
Right.
And it's like that's and I'm not saying it ain't always the truth, but because sometimes they might be thinking about breaking up with you. I don't know, but it's like you sitting there worrying about it and having this prophecy that is going to happen. It's not going to help.
Right. That
And,
feeling is real though. That is so real. Like I've been in that feeling before, like they didn't call. Okay. They usually do this. But I think too, like it's the patterns that people have. Like you looking at their patterns and you're like, okay, well, now now I'm gonna be worried because they're not following the patterns that they have. But I agree with you that it's not, you need to find something else to do besides just sitting there and having anxiety about what could happen. Because a lot of things could happen, but we still just, go about our day. And whatever you do, if you, I guess, if you pray or meditate, or maybe you don't, then you just go about doing it. But with certain people, I guess it's just, I've been there. It's
yeah,
hard.
I mean,
It's
it's
hard
so
to
many
do.
of us that have these protective factors, like you just mentioned, meditating, prayer. Some protective factor might be listening to music or making music, um, exercising, um, eating green leafy vegetables. Um, so it's a lot of things that are protective factors, and they help us, navigate our way through the world. And I think at going to counseling and going to therapy should help us recognize those protective factors and use them as our shield to everyday anxieties and stressors. Yeah, so I'm so happy we had a chance to have this conversation.
It's just one more thing that I need to, I feel like I need to say about therapy. You can't go to therapy and do however long your session is, like 30 minutes or an hour in the therapy, and only do the work in the room.
Right.
You have to like do the homework that the therapist or whomever they give you when you leave and practice it in real life. Because if you don't, then you're just gonna, I mean, it's just a, I guess, a vicious cycle. You know, you're going, you decompress when you get there, and then when you leave, you just bottle it all up because you're not using the skills that they give you. So it's important to also do the work outside of therapy.
Excellent. Excellent. Thank you for that bit of knowledge because um, anyone who haven't went to therapy would be surprised probably that they got to do work outside because the real change happened in between sessions.
Right. This is a fact.
So thank you so much. You want to real quickly give us again where we can find you and your husband's information as far as your business.
So we are Naughty Fox Apparel. We make t-shirts and hats and scarves, knit items. You can find us on naughtyfoxapparel.com, Instagram, Naughty Fox Apparel, Facebook, Naughty Fox Apparel.
Now you create T-shirts.
Yeah, we do create t-shirts. So we do sublimation and vinyl t-shirts. They can be, you know, if you have a design that you prefer to have put on a t-shirt, we can do it that way, or we do create the t-shirt designs as well.
Well, I think a lot of people will like me on their T-shirt.
Okay,
Just like this.
we'll set up a set
So
up an order.
yeah, I think that could be your top seller. I think
Okay,
your top seller. But
what are
thanks
we gonna call
again,
it?
Dr. Malik Rahim's podcast, something like that. I don't know.
Okay.
We could do something. But thank you so much for joining me and giving me your experiences with going to therapy. Now I have a quick question before we leave.
Hmm.
Does vitiligo only impact people of African descent, black people?
No, and actually is 1% to 2% of the world's population. So we're looking at 8 billion people in the world right now. That's like 80 million to 160 million that's affected. And it doesn't matter if you're, you know, uh, African descent or European descent or Asian
Mm,
descent, Middle Eastern, whatever. It affects 1% of the population. And there's there's been like a struggle within the community and everything, where some people feel um, they're not acknowledged for having vitiligo. I know
really?
people who are more fair skinned or like white, people tell them like, I don't see your vitiligo, even though,
Mm,
if you really look closely, you might be able to see it.
mm,
I remember I was at a conference and this one girl, she was she was Latina, and she was like, she was really pissed and upset that people would not acknowledge. And I was like, look, I don't know what they're on, but I see your vitiligo. Because like, no matter what, whether a person can say, oh, I see it very clearly, or, you know, I see it very faintly, or I don't see it at all, you know what's going on with your body. So whether someone else acknowledges or doesn't acknowledge it, you know what I'm saying?
right.
What matters is your perspective of it. So in your perspective, you see your pigment changing all over your body. And, it's very frustrating when other people won't acknowledge, like, oh yeah, I do see, your vitiligo, or I can understand, I'm sure you have struggles, because there's an internal struggle, because sometimes people notice when one little pinprick spot pops up. I know for me, my spots are constantly changing. So I notice these things. And other people may not notice, like, man, oh no, your vitiligo still looks the same. But no, I notice the different patterns and everything as it changes.
Right.
And sometimes in the community, there's this um, distinct on colorism where people kind of exclude people experiences having vitiligo. So, that's a whole nother part of the community that, I feel needs, focus on and looking at.
Right. Almost like my oppression is deeper than yours because my vitiligo is more seen than yours is.
Yes, exactly. That's exactly it. And, I think as far as a community of individuals who support each other, that can actually do damage, you know, emotional damage to someone who's struggling with their vitiligo, feeling unseen, or even with, other people may have a chance to like notice and really pay attention, like what's going on when another individual of color doesn't see a big problem, because like, well, your tones kind of look the same and everything like that. I can't tell the difference.
Right.
That's really doing a disservice to that individual, invalidating their experiences and whatnot.
Exactly. Exactly. This almost really messes with their identity. Like, I have no place to go. I'm shunned by this. I feel shunned by this community, and I feel shunned by the community I should feel welcomed by. You know,
Hmm.
what do I do? So it really messes with a person's mental health potentially.
Oh man, there's such a struggle there, um, especially when people feel like, man, this person should be able to understand what I'm going through. And then when you talk to them and they're like, well, I don't really see that you have a big issue because your pigment is kind of very similar. So, you're what you're talking about, I don't connect with it because I know I go through struggles, and I don't think you really go through the struggles I go through. You cannot, you know, tell an individual, you know, what their struggles are. You can't walk in another individual's shoes. All you can do is just listen and hear what they're saying. And you might be able to connect with that individual on some level if you listen.
Right. I think I was having a conversation on a other episode. That was we were talking about submission as far as in relationships,
Mhm.
And one of the things I was saying is that as men, we get this concept of masculinity of being so strong that a lot of times when we got to get comfortable being able to listen and not having the feeling that we got to solve the problem. Because a lot of time our significant other will bring us a problem, but all they want to be is heard. But we're too busy trying to, because we're trying to protect it, we're so busy trying to solve their problem and not actually listening to their problem, their issue, the concern that they have. And once we start learning to actually listening, we create that safe space so they could feel that they can submit. Because submission, for a person to submit to you, they got to feel safe that you're not going to take advantage of them, you're not going to do them harm. And if we're sitting there always trying to solve the problem, sometimes they just want to be heard.
I absolutely agree. Absolutely agree. I think fundamentally, we want validation, especially when we're going through like similar struggles and everything like that. And to not get that validation, you never know what impact that may cause, whether a person may like isolate themselves or shrink inwardly and disconnect from people. I say you have to listen exactly what this person's message is and respond in kind, have empathy, have compassion, for another person's experiences.
Exactly. Wow. Well, again, thank you, sir, for the deep conversation. And I look forward to sitting down and meeting with you again and maybe breaking some bread or something.
For sure. I look forward to that.